Hello, my name is Robert Tasker and I'm the Editor-in-Chief of Pediatric Critical Care Medicine. July 2021, another great issue, all the content very much worth reading. I'd like to focus on just 3 groups of articles if you're short of time and you want a more general update. The first is COVID-19. I'm very pleased to be able to tell you that we're able to publish the SCCM virus discovery paper covering the period March 2020 to January 2021 by Tripathi and colleagues looking at the cases of COVID in ICU stratified by presence or absence of MIS-C. Along with this article, I've also published a special article that I commissioned Drs. Remy and Kissoon to write about where do we go from here in regard to COVID publications. And then a first. I've asked Dr. Schrober to write the first of the Concise Clinical Science Review. These are brief reviews, 50 references, focusing on the basic science of some aspect of pediatric critical care, and she writes on neuro-COVID. The second group of articles focuses on what bereaved parents want us to know. Bogetz and colleagues interviewed 110 parents who have been bereaved and asked them various things, and what came across was better communication and trust. We have an editorial, and please have a look at the April issue of PCCM as well for the study from the NICHD. And then the third group of articles, what is the early time course of acute kidney injury? And Alobadi and colleagues look at 300 cases of AKI in the PICU. There's an accompanying editorial, and please look at the April issue for the article about 1-year outcomes of AKI. And then in terms of the supplementary materials that are available to my much valued subscribers and readers, is an article in the Notes, Methods and Statistics section written by Dr. Brilli and colleagues about the new paradigm of quality improvement studies, moving away from what is to what should be and how do we get there. And if you remember last month, we had that great systematic review of all QI articles in pediatric critical care. And so this is the natural follow-on. And if you've been reading PCCM closely over the last year, you'll realize that there's a wave of articles coming through on point-of-care ultrasound. And we have a perspective written by a group asking or telling us about a call of action. How do we regulate and how do we develop this? So just to close, thank you very much for subscribing, for being members, and please enjoy the reads. Thank you very much. See you next month.